Warning: if you care about your eyesight, this video could save it. Did you know that, without realizing it, you could be putting your vision at risk right now? The numbers are scary. More than 60 million people worldwide have glaucoma, and cataracts affect over 95 million. But here's the really shocking part. Some common medications, ones you might take every day, can make these silent eye conditions worse. Imagine, what you swallow to treat one illness could be speeding up vision loss. Is this already happening to you? In this video, we'll reveal 5 medications that, on their own, could worsen cataracts and glaucoma. And believe me, the last one on the list is one you can't afford to ignore. But don't worry, I'm also going to tell you about some simple and important steps you can take to protect your eyesight starting today. If you want to help save the eyesight of other people like you, like and share this video right now. Your action could make all the difference. Have you noticed any subtle changes in your vision lately? What if it's because of these medications? Let's find out right now. Before we dive into the medications to avoid, let's take a moment to clarify what exactly cataracts and glaucoma are. Imagine looking at the world through a foggy window with increasingly blurry vision. That's how people with cataracts see their surroundings. A cataract is that cloudy veil that gradually forms on the lens of the eye, the natural lens that's normally clear. But how does it form? The number one cause is simply aging. With age, the proteins in the lens start to break down and clump together, forming opaque areas that disrupt vision. Then there are ultraviolet, UV rays, an invisible but constant threat. Prolonged exposure to sunlight without proper protection can speed up this process, causing the lens to become cloudy. Another often overlooked factor is diabetes. This disease affects the metabolism of the lens, creating favorable conditions for cataracts to appear more quickly. But that's not all. Smoking, obesity, high blood pressure, and even some common medications can also play a role in cataract development. And this is where things get serious. Some of the pills you take for other health problems could actually worsen these eye conditions. As for glaucoma, it's an increase in pressure inside the eye that can damage the optic nerve and lead to permanent vision loss if not treated in time. That's why it's essential to protect your eyes and see an eye doctor regularly, especially after age 50, because these diseases often progress without symptoms at first. Now let's explore together which medications can accelerate these eye conditions and how to avoid them. Let's start with a very common type of medication: corticosteroids. These powerful anti-inflammatories are often prescribed to relieve various ailments, whether it's treating conditions like asthma, allergies, or autoimmune diseases. You may have already used them in the form of creams, tablets, eye drops, or even nasal sprays. Their effectiveness is well established, but did you know that they can also pose a risk to your eyes? An alarming study published in the Journal of Glaucoma in 2019 revealed a worrying link between prolonged corticosteroid use and the development of posterior subcapsular cataracts. Specifically, these drugs disrupt the protein balance in the lens of the eye, which accelerates its clouding. In other words, corticosteroids can speed up the aging process of your eyes, making them more vulnerable to cataracts. And that's not all. Prolonged use of these medications can also increase intraocular pressure, which worsens the risk of glaucoma in some people. Another study, published in Ophthalmology the same year, showed that in some patients, corticosteroids can trigger a significant increase in this pressure, potentially leading to irreversible damage to the optic nerve if glaucoma is not detected and treated in time. So, if you regularly take corticosteroids, don't panic, but talk to your doctor. It's essential to discuss your options. They might adjust your treatment or recommend more frequent eye exams to closely monitor the condition of your eyes. Now let's move on to antidepressants, essential medications for millions of people suffering from depression and anxiety. Although they provide valuable relief, they can also have unexpected effects on the health of your eyes. A study published in the Journal of Clinical and Experimental Ophthalmology in 2020 highlighted a concerning link. Some antidepressants, particularly selective serotonin reuptake inhibitors, SSRIs, increase the risk of developing glaucoma, especially angle closure glaucoma. But how exactly do these medications affect your eyes? In reality, SSRIs can cause pupil dilation, a phenomenon that can be particularly dangerous for people already predisposed to this form of glaucoma. This dilation can disrupt the natural drainage of fluid in the eye, leading to an increase in intraocular pressure. If this pressure remains too high, it can damage the optic nerve, causing permanent vision loss. But that's not all. Antidepressants can also dry out your eyes, which can worsen symptoms like dry eye, increasing the risk of irritation and infections. This doesn't mean that you should stop your medication without consulting your doctor. Untreated depression can have serious consequences for your overall health, including your eyesight. So, if you're taking antidepressants, it's essential to add a regular visit to an ophthalmologist to your medical routine. Your specialist will be able to closely monitor your eye pressure and make sure everything stays under control. Number 3. Antihistamines. Allergy relief, but stress for your eyes. Think your antihistamines are risk-free? Time to rethink that idea. These medications, which you use to soothe your allergy symptoms, can have an unexpected side effect, a negative impact on the health of your eyes. A study published in 2020 in the Journal of Clinical and Experimental Ophthalmology highlighted an often underestimated risk. Regular use of antihistamines can increase the risk of dry eye. But how does it work? Antihistamines work by blocking a chemical called histamine, which is responsible for allergic symptoms such as itching, runny nose, and watery eyes. However, this blocking also affects an important mechanism: natural tear production. Without enough tears, your eyes become drier, which creates an environment where the lens can degrade more quickly, thus increasing the risk of cataracts. In addition, dry eye can lead to chronic irritation, worsening intraocular pressure, a key factor in the development of glaucoma. If you take antihistamines regularly, especially during allergy season, it's essential not to neglect your eyes. A visit to the ophthalmologist might be necessary to assess the condition of your eyes and identify possible solutions, such as moisturizing drops, to maintain good eye moisture and prevent long-term complications. Number 4. Beta blockers. A dangerous paradox. Beta blockers, commonly prescribed for high blood pressure and certain heart problems, can be a trap for your eyes. It's a real paradox. While they are used in eye drop form to treat glaucoma, oral beta blockers can sometimes make it worse. A study published in the Journal of Glaucoma in 2019 showed that some oral beta blockers can increase intraocular pressure in some people. This increase can be enough to cause significant damage over time. How can this phenomenon be explained? Systemic beta blockers, taken orally, can reduce blood flow to the optic nerve, making it more vulnerable to damage caused by high pressure. In addition, they can cause dry eyes, worsening the symptoms of glaucoma and cataracts. If you are taking beta blockers for a heart condition, do not stop taking them without medical advice. But get your eye pressure checked as soon as possible. Your doctor may be able to adjust your treatment or prescribe more frequent eye exams. Number 5. Anticholinergic medications. A silent threat. Anticholinergic medications may be the most dangerous for your eyes, and yet many people don't even know this term. These medications are used to treat various conditions like incontinence, Parkinson's disease, or certain types of allergies. A study published in the Journal of Glaucoma in 2019 showed that the use of anticholinergic medications can increase the risk of angle closure glaucoma. This study revealed that these medications can cause pupil dilation and paralysis of the ciliary muscles, which can quickly lead to an acute glaucoma attack, a medical emergency that can cause permanent vision loss if not treated promptly. In addition, anticholinergics can cause severe dry eye. Your eyes then become more vulnerable to damage, potentially accelerating the progression of cataracts and glaucoma. If you are taking anticholinergics, an ophthalmological consultation is urgent. Your doctor will be able to assess your risk and perhaps consider therapeutic alternatives. Act now to save your sight. Your vision is at stake. If you are taking any of these medications, don't panic, but act quickly. Here's what you need to do right now. Number 1. Contact your doctor today to discuss your treatments. Don't wait for your next scheduled appointment, call now. Number 2. Make an appointment with an ophthalmologist for a complete exam. Even if your eyes seem fine, an exam can reveal problems before they get worse. Number 3. Never stop a treatment without medical advice. The risks of abruptly stopping certain medications can be more serious than their side effects. Number 4. Watch for any changes in your vision and report them immediately. Symptoms like blurry vision, halos around lights, or eye pain should be taken seriously. Number 5. Adopt a healthy lifestyle for your eyes. Wear sunglasses, eat a diet rich in antioxidants, and take regular breaks if you work on a screen. Number 6. Find out about possible alternatives. In some cases, there are alternative treatments that may be less risky for your eyes. Number 7. If you have a family history of glaucoma or cataracts, be especially vigilant. The risk is higher for you. Remember, every day counts when it comes to protecting your eyesight. Vision loss due to glaucoma is irreversible, and although cataracts can be treated surgically, prevention is still the best approach. Don't let these medications silently steal your vision. Your eye health is too important to be neglected. Act now. The potential benefits are immeasurable for years to come. In conclusion, stay informed, be proactive, and never hesitate to ask your healthcare professionals questions. Your vision is worth every effort you make to preserve it. Take care of your eyes. They are your windows to the world. If you found this video helpful, give me a thumbs up and share it widely. See you soon on Health Tips.